Hi, my name is Tabitha Butcher. This is my video presentation for our health promotion project, and my disease is Addison's disease. Addison's disease you might also commonly hear being called primary adrenal insufficiency or PAI. The definition: Addison's disease is a chronic adrenocortical insufficiency due to inadequate adrenal cortex function. The etiology: any disease that can cause direct injury to the adrenal cortex can result in Addison's disease or primary adrenal insufficiency. Autoimmune destruction of the adrenal glands is the most common cause, but it can also be caused by other factors like infections such as HIV, sepsis, tuberculosis, and fungal infections. And here's a photo of Addison's disease and the different symptoms that you might see with Addison's disease, which we will go over those further. Next, the pathophysiology. So PAI results in decreased cortisol production, initially followed by that of aldosterone, both of which will eventually cause elevated adrenocorticotropic hormone and plasma renin levels in the blood through loss of negative feedback inhibition. So a lot of times with Addison's disease, it's a loss of cortisol, so you will have like corticosteroids often that you will see in this treatment. And here's a photo of someone with Addison's disease, and you can see like some dark pigmentation of the skin. It's got just some blotchy random areas of dark pigmentation. Manifestations. So you will typically see muscle weakness, possibly some anorexia, GI symptoms, fatigue, emaciation, the dark pigmentation of the skin and mucous membranes, and oftentimes you will see that in the lining of their gums, on their knuckles, elbows, knees, places that kind of have more skin buildup and bony prominences. You'll see low blood glucose, low serum sodium, and a high serum potassium. Addisonian crisis, you will see some symptoms like hypotension, cyanosis, fever, nausea, vomiting, signs of shock, headache, abdominal pain, and diarrhea. And an Addisonian crisis is considered a medical emergency. And here is another photo of a manifestation. So you can see this person's teeth, their gum line. It's extremely dark right under their teeth. So you'll see that a lot in patients' mouths with Addison's disease. So it's good to do a full head-to-toe assessment to look for those signs. Diagnostics and testing. So typically you would start off with doing lab tests. And what you're looking for, you're measuring the sodium levels because sodium is going to be decreased, potassium is increased, cortisol and the ACTH in your blood, and also blood glucose levels you're going to look for. X-rays, they are used to examine calcium deposits on the adrenal glands, and I actually have a photo of an X-ray to show that. It's hard to see on here, but you can see calcium deposits. CT scan, this is used to evaluate adrenal and pituitary glands. This test can show if the immune system is also damaging the adrenal glands. Next, we're going to look at complications of the disease, which the main complication we are going to focus on is an Addisonian crisis. And this because, again, this is considered a medical emergency, and if not treated very quickly and recognized quickly, you are highly likely to die from this. So an Addisonian crisis is the progression of the disease, and symptoms to look out for include shock, hypotension, rapid and a weak pulse, rapid respiratory rate, pallor, and extreme weakness. And it's good to teach the patient these things too so they can alert the nurse if they're having any of these symptoms. Physical and psychological stressors like cold exposure, even a little bit of overexertion, infection, emotional stress should be avoided. Immediate treatment with IV administration of fluid, glucose, replacement of electrolytes is needed to help with the treatment of an Addisonian crisis. The NLN competency I focused on was human flourishing. And this is to promote the dignity, integrity, self-determination, and personal growth of each patient as an individual, and to provide culturally appropriate and relationship-centered care. And I focused on human flourishing because I feel like it's important with Addison's disease to really focus on that patient as an individual, because it's not the most common disease, so they might already feel singled out and feel alone, so it's important to have that relationship-centered care. And then some teaching points I added for this patient would be to teach the symptoms of Addison disease, not only to the patient but to their family, so they can recognize those warning signs really quick. And wear a medical alert bracelet or a necklace, and that way in case of an emergency, someone would know that you need medical attention immediately. Also carry a syringe and a vial of dexamethasone or another corticosteroid that your doctor might prescribe in case of an emergency. And this is for glucocorticoid treatment of an Addisonian crisis. So it's good to keep on hand, kind of like you would carry an EpiPen if you have a severe allergy. It's good to keep on hand. And that is my presentation on Addison's disease. So I hope everybody learned a lot and enjoyed my presentation. Thank you very much.